Hi, I'm Dr. Bill Cushing, and today I thought it appropriate, at this point, to spend some time discussing how illegal coding and billing can result in significant consequences for a physician and practice. I will address the False Claims Act, HIPAA, and high-tech. First, the False Claims Act. The False Claims Act has been the federal government's primary tool for combating fraud in federal government programs. The False Claims Act applies to all efforts to fraudulently have the government pay out money. Liability under the False Claims Act attaches to the individual or healthcare entity seeking a government payout at the moment a fraudulent claim is submitted to the government. Submitting the fraudulent claims to Medicare or Medicaid is a good way for a practice to get caught up in the liability of the False Claims Act. Billing for services that were never provided is fraud. Upcoding services in order to get a higher rate of reimbursement is fraud. Upcoding occurs when a claim is submitted for a more expensive service or procedure than was actually done. Providing worthless services to the patients and then seeking payment for them from the government is also fraud. Implying certifications concerning the practice or healthcare entity that do not exist in order to justify a claim for payment is fraud. Failing to report and return an overpayment by the government to the provider or healthcare entity with 60 days also exposes the provider or entity to liability under the False Claims Act. The federal anti-kickback statute criminalizes the payment of benefits or remuneration, direct or indirect, in exchange for a referral relating to a federal health care program. Violations of the anti-kickback statute are considered violations of the False Claims Act. The False Claims Act has triple damages and additional penalties that can severely damage the financial health of a practice or a healthcare entity. The False Claims Act allows private persons to file suit for violations of the False Claims Act on behalf of the government. The government is required to investigate the allegations in the complaint and decide if it wants to intervene in the action. If the government intervenes in the action, it has the primary responsibility for prosecuting the action from that point. So, if the government intervenes and a judgment or settlement is obtained, the individual initiating the complaint is also entitled to receive between 15 and 25% of the amount recovered by the government. That's right. They share in the settlement. So an individual could notice that fraudulent billing is being done and decide to initiate a complaint. If the fraud is significant enough, the federal government may decide to take the case over. At that point, you are in serious jeopardy. And again, the penalties for violating the False Claims Act can be financially devastating to a provider or a healthcare entity, particularly since the penalties are assessed on a per-claim basis. That's right, on a per-claim basis. Each false claim carries its own penalty. First, each violation or false claim carries a civil monetary penalty of no less than $5,000 and not more than $10,000. That's for each claim. Then you have the consideration of triple damages. That's right, triple actual damages. So, if you're on the wrong side of a False Claims Act suit, you can find yourself in serious trouble. Well, I hope this helps. Have a good day.